Hello all, my name is Scott Mollett and I'm the owner and founder of AT Efficiency, a research and data analytics firm focused on sport and rehabilitative medicine. I'm here to present on several novel ideas which center on modernizing the profession of athletic training. This might not be the proper term to label these ideas, but I feel that the process of what we do is overall antiquated. This is coming from a documentation and analytics perspective. Within these areas, we are lagging. However, this is mostly due to several factors, including access, training, bandwidth, and cost. I'd like to use this short presentation to begin the discussion in hopes we can establish a direction to conduct more research on these areas. The goal in mind centers on making this great profession even better. As addressed within my opening remarks, these are ideas with intentions to promote further discussions for the profession at large. Without a doubt, the profession continues to change, with master's entry-level education leading the way. As more programs settle into their new framework, specific areas should be addressed as it pertains to the modernization of the athletic training profession. Within this presentation, the topics include EMR and documentation practices, data to drive decisions, technology to improve patient care, interprofessional practice, and a team approach to healthcare, precision prevention of musculoskeletal disorders, the impact of population management. More can be discussed, however, to keep this short, I will focus on the basics regarding these topics. As reported by Nottingham et al., more thorough documentation practices occur within emergent settings, which makes sense as more time and resources are available. Additionally, expectations are higher within these sectors to have complete notes. Just as important, the athletic or sports medicine settings need to have higher expectations regarding note documentation. However, time seems to be the main factor which hinders complete injury or daily track and documentation, as again reported by Nottingham et al. To modernize, more emphasis on EMR capabilities could improve documentation for athletic trainers working within the athletic healthcare setting. This might include more access to mobile devices, including bandwidth, pre-populated drop-down menus, talk-to-text dictation, home exercise programs, outcome measures. However, it's understood that the EMR discussion is only one piece of the puzzle and is its own presentation topic. Data-driven decisions are not unique to the work we perform as athletic trainers. In fact, I'd argue that athletic trainers have access to the most amount of data regarding our patients. So how do we harness all this information? How can we drive decisions based off our data? Perhaps the silver lining is with prevention. Recent research suggests AT spend a considerable amount of time providing preventative services to their patients and managing non-time loss injuries, or otherwise injuries which do not require loss in activity participation. Correlating preventative interventions to how a patient is feeling could be an area where more research is conducted. From here, a cost analysis could be completed. This could possibly lead the way for precision musculoskeletal prevention based off the data we harness. Through patient history and technology utilization, the concept of musculoskeletal disorder precision prevention can be an important notion within the profession. Derived from precision medicine, which, according to the FDA, is an innovative approach to tailoring disease prevention and treatment that takes into account differences in people's genes, environments, and lifestyles. Regarding musculoskeletal disorders, it's important to consider the patient's past medical history, physical skills and abilities, and anthropometrics. More investigation needs to occur within this context. Additionally, I'm working on content which dives deeper into musculoskeletal disorder precision prevention programs, including how does it work, data points to consider, cost analysis correlation, and proposed research projects. Technology to improve patient care is continually making headways within the profession, but there are challenges to implement, including access, bandwidth, and the biggest challenge, cost. However, in the instances that this technology is utilized, there are countless possibilities to improve patient care. As reported in the NATA News 2022 Research and Technology issue, virtual reality or VR provides athletic trainers with added resources to make return to play decisions, manage concussions, provide functional training programs which include cognitive and sensory motor control, and VR continues to be a growing trend as the equipment is becoming more available and less expensive. Additionally, VR can also be associated with wearable devices, but there are some differences. Again, NATA News featured a 2021 issue on wearable devices, which athletic trainers are utilizing. As smartwatches become more advanced, more features can be used to track streams of data, as one example. However, specific wearables can monitor velocities, or acceleration and deceleration, which can be important for injury prevention or included within a rehabilitation program. While it's obvious teamwork is important within healthcare, numerous studies continually circle back to this notion that interprofessional collaboration, or two different healthcare practices working together, does indeed improve patient outcomes. The team approach within athletic training is not only improving, but more research continues to be conducted on this topic. However, the momentum needs to carry on. Additionally, more emphasis on interprofessional education needs to be front and center within an athletic training curriculum, if possible. Remember, it's not us against them. We are all working together to achieve a common goal: improve patient outcomes. Athletic trainers are population healthcare experts, and this needs to be ingrained within our education. The athletic health model is true and tested, and as Shane Lee et al. Discusses, the athletic trainer has been installed as the central figure in managing all aspects of student athletes' health, triage, care coordination, and resource used. Within the context of school-based athlete healthcare, the athletic trainer is the primary healthcare provider in these situations, and in some areas of the country, the only healthcare provider student athletes have access to. Therefore, the idea that the athletic trainer manages the health care of a small population of individuals is accurate. Prevention and return to participation programs add to this population health perspective. A new concept, but with many working parts, more research and discussions need to be had. There's the understanding that antiquated processes, procedures, and directives are outside the athletic trainer's control. But steps have already been made. Despite debate and negative initial reactions, master's entry-level athletic training programs were influenced with the notion in mind to modernize the profession by offering new skills and techniques. Additionally, Ohio's Practice Act, House Bill 74, which passed, changes the language within the Practice Act, which includes these new skills. However, this is only a glimpse at the direction the profession can go. Other elements need to be added, and I challenge you to reach out to me and let's work together on research or other projects that center on these areas. Thank you so much. I hope you have a great rest of your day.